Hi, everyone. My name is Amanda Young, and I am a member of the SACI TTA team. I'd like to welcome you all to today's researcher working group. Before we get started, I do want to give a friendly reminder to please keep your audio on mute unless you are speaking. And then also, if you have questions, we'll have plenty of time for questions during today's discussion. Please feel free to type those in the chat pod, or when we get to the Q&A at the end, you are welcome to use the reactions and raise your hand and come off mute and share your questions then as well. So we have the pleasure of having Dr. Rebecca Campbell with us today for our presentation. Dr. Rebecca Campbell is a professor of psychology at Michigan State University. She holds a doctorate in community psychology with a concentration in statistics from Michigan State University. For more than 25 years, she has conducted community-based research on violence against women and children with an emphasis on sexual assault. So at this time, I will go ahead and turn it over to you, Dr. Campbell.
All right, thank you, everyone. Let me just give a quick second to adjust my screen to something, and then we're going to go ahead and get started. All right, so welcome, everyone. As Amanda said, my name is Rebecca Campbell, and I wear many different hats. I'm a professor of psychology and program evaluation at Michigan State University. I'm a member of the SACI National Training and Technical Assistance Team, so I might have met some of you before at our TTA meetings. I'm also the research partner for the Michigan State Police site. I'm going to be sharing some of that work with you today. And I am working currently in that role with our colleagues in Kalamazoo County and see some of them there today. So it's good to have you here. And in the past, I've worked with colleagues in the city of Detroit, and I see some of you on the call today. So I have many, many different hats, whether I'm doing independent research, doing collaborative research with some of you here in the SACI project, or working with our colleagues on the national SACI TTA project. So today I'm really excited to have an opportunity to share with you some research that my colleagues and I at the Michigan State Police did as part of our statewide SACI project here in Michigan. And this is work that was recently published in the Journal of Forensic Sciences. And I want to give a shout out to our colleagues from the Michigan State University research team, Mackenzie Javorka, Dhruv Sharma, and Katie Gregory, as well as our colleagues at the Michigan State Police, Matt Opsimer, Kristen Schelling, and Lauren Liu. This was very, very much a collaborative effort to try to understand how do forensic testing outcomes compare by geographic and population density characteristics. So before I get into the specifics of that study, I want to take a few minutes to talk about what we know from prior research on unsubmitted or untested sexual assault kits. I think broadly defined, we can talk about the research that's been done on untested or unsubmitted kits as sort of two main buckets. There's been studies that have been trying to understand the national landscape. What is the scope of the problem of untested kits throughout the US? And then there's site-specific studies where we've worked with individual sites, like work I've done in Detroit, or work I'm currently doing in Kalamazoo County in Michigan, or even an entire state, like what's happening in the state of Michigan. So the size of that site might vary from a city to a county to a state, but it's still like looking at a specific site as opposed to trying to get the national landscape. So let's take a few minutes to talk about some key highlights from prior research in each of these two buckets to help set the stage for today's study. So when we look at national landscape studies, the real focus there is trying to understand what is the scope of the problem on a national level of unsubmitted kits. So for example, one of the first studies that tried to get us this national landscape study was done by Lovrich and colleagues back in 2004. And what they did was a national random sample of surveying law enforcement agencies, LEAs, and they asked them to estimate how many unsolved cases with unsubmitted evidence do you have in your property room? Now, the reason why people use estimation methods is that it's really hard to do an exact count of every single case of every single piece of unsubmitted evidence. So at least back in the early 2000s, our best method there was, let's do some estimating. And so they estimated number of untested kits there. That study was replicated and extended by Strom and Hickman in 2010, again, asking estimates of how many unsolved cases, unsubmitted evidence. What we learn from these estimation methods is that estimates are easier than doing an actual count, but it's really important that we're all estimating the same way, that everybody's using the same definition to estimate how many unsolved or unsubmitted cases they have. But obviously the key problem with that kind of methodology is the word I keep using over and over again, which is estimate. They're still estimating how many cases they have. So over the years, we've been trying to shift away from estimating methods to actual counting methods. Now, even so there, it's still hard to get a true national count of how many unsubmitted kits we have in the US. But I think the best method we have so far is from that newest paper that's on your screen from Strom and colleagues that's in press just now, hot off the presses. So if you don't have that, talk with your SACI site liaison so that you can get that. What I think is really cool about this study is that they took actual counts from some jurisdictions. So rather than estimating, they really went through and counted and did a census. How many unsubmitted kits do we have in these jurisdictions? And then using really sophisticated quantitative modeling techniques projected from actual counts to get a national estimate. So it's still an estimate, but it's based on a really good count and statistical modeling. So from that estimate, what they've been able to deduce is that we're probably looking at between 300,000 to 400,000 unsubmitted sexual assault kits in jurisdictions all throughout the United States. So in big cities, medium-sized cities, small cities, we're still looking at a large number of unsubmitted kits. So this really is very much a national scale problem. Now, flipping gears, switching gears a bit and thinking about research in a different way, what do we know from site-specific studies? So moving away from the national landscape to try to understand what do we know in specific jurisdictions about inventory, how many kits, what are the root causes, what are the forensic testing result outcomes? Now, to date, site-specific studies have really been done primarily in these cities: Los Angeles, Detroit, Houston, and Cleveland. So what we know from these cities that have actually been able to inventory kits, start submitting them for testing, see what kind of testing results they get, what we find is that the evidence in those unsubmitted kits is still viable for DNA testing. So even though they may be 5 years old, 10 years old, 20 years old, or beyond, the evidence in those, the samples in those are still viable for DNA testing. So that's a really major thing we've learned from these site-specific studies is don't toss the kits. The evidence in them is still viable for testing. And interestingly, what we see across these different studies is a very common pattern that's starting to emerge, that approximately 50% of the kits that are tested will yield a DNA profile that meets eligibility for upload to CODIS, to FBI CODIS. So the quality of the DNA sample, the information about the case, meets all of the eligibility criteria to be loaded into CODIS. And then once those profiles are in CODIS, about 50% of those profiles will result in a CODIS hit or a match, meaning that the DNA sample that we uploaded from our kit matches to either a sample in the offender index from a known reference sample, or our kit is hitting to something in the forensic index, hitting to another case, another unsolved case, or another previously unsubmitted kit. So that's kind of what we call the half and a half effect. So if you take a batch of kits and test them, about half will have a profile that will go into CODIS. And then of those that went into CODIS, about half are going to yield a hit. That's a substantial number of untested kits yielding CODIS hits. So based on the results from Los Angeles, Detroit, Houston, and Cleveland, this really forms a very strong empirical evidence that suggests we really need to be testing these older kits. We need to be testing previously unsubmitted kits because, again, a substantial number of them are going to result and produce a CODIS hit. Now that said, I want to pause for a second and say, so what do these site-specific studies have in common? Los Angeles, Detroit, Houston, Cleveland. What do they all have in common? They're large urban cities. They're also cities with very strong racial and ethnic diversity, and they're all cities that have pretty high crime rates. What did our national landscape studies tell us? That this is truly a national problem. It does happen in big cities. We do have large urban cities with large numbers of untested kits, but we also have untested kits in medium-sized cities. We also have them in small cities. We also have them in rural areas. So we've got a little bit of a gap here between most of the site-specific studies really focusing on those large urban areas, but yet we know this is a national problem. So it's a national problem that's often easier to study at the site level because then you can really kind of drill down and get more specific. So how do we bring this together? And that's actually what the National SACI Project is about. The SACI grantees cover large big cities, they cover small cities, they cover statewide sites where we have a mix of some big cities, some small cities, and the like. So that's where we start today's study and today's research. The Michigan State Police was one of the SACI 2015 statewide sites, and they partnered with myself and my colleagues here at Michigan State University to study what happens when you test kits in a lot of different jurisdictions, not just the large urban areas, but if you do a statewide site, you're going to get some big, some small, some in between. What are we finding when we test kits from other types of communities with different geographic characteristics, different population density characteristics? So that's what we wanted to focus on here in the Michigan SACI site. And again, this was one of the 2015 SACI statewide sites. So before I get too much into what our study was and what we found, I want to set the stage a little bit by telling you about the Michigan State Police SACI project. Consistent with the SACI philosophy of having a multidisciplinary team, our team consisted of representatives from the Michigan State Police, the Michigan State Police Forensic Science Division, so our forensic scientists, our crime analysts, the Prosecuting Attorneys Association of Michigan, so that represents all of our elected prosecutors across all of our counties. We also had the State Attorney General's office at the table, and the Michigan Department of Health and Human Services Division of Victim Services, which is a lot of words to say. Those are our advocates. That's the state entity in Michigan that administers our VOCA money and our VAWA money and funds, trains, and supports our rape crisis centers or victim advocacy organizations. So in addition to all of those state level partners, we also had some representatives from local law enforcement, some local prosecutors, some local advocates to make sure that when we're talking about the state, we're not losing the feel for what our individual cities and individual jurisdictions are like and what are some of the local level challenges that people face when they start testing kits, investigating, and doing notifications. And then finally, us, the research team, again, coming from some prior research in Detroit, a long history of working on these issues of unsubmitted kits. So what was the purpose and scope of the Michigan State Police SACI project? Well, consistent again with all of the SACI sites, we had to do an inventory. We had to do an inventory of all previously unsubmitted SACs in our state. And what you see on the far right of your screen is the operational definition, the exact words, the exact rules, if you will, that we gave to all law enforcement agencies in all of our counties to tell them how exactly to count their kits, not to estimate, but actually go to your property room with this definition in hand and go count your kits. The long and short of all those words is when we say count every kit, we meant count every kit. So whether you think it was outside the statute of limitations, count it. Whether you think it's previously adjudicated, count it. Whether you think it's unfounded, count it. Whether you're not sure it's complete, count it. Count everything up to the date of March 1st, 2015. That date was selected because that was coincided with some recent legislation that we had in Michigan that said from everything from March 1st on, you have to submit for forensic testing. It's no longer discretionary. So by forming the inventory on everything before March 1st, 2015, we're getting a statewide count of everything that had not been previously submitted. Now let's read the fine print. Excluding the city of Detroit, excluding the city of Flint. So it's a statewide census excluding those two cities. Why? Because both of those cities were also SACI 2015 sites. So the city of Detroit, through the leadership of the Wayne County Prosecutor's Office, had a SACI grant. The city of Flint had a SACI grant. So those inventories are not in the data I'm sharing with you today. I promise at the end, we'll talk about, did that change the results? What does that mean? But for now, just know they're not there. Those cities are not there. However, the counties that those two cities are in, they are included in the Michigan State Police grant and will be included in the data that I share with you today. So Wayne County has many other large cities. The Genesee County has other cities. So all of those other cities are included in our count. We tested everything that we inventoried. It was all outsourced. Everything was tested. And then as the results came in, the SACI team worked with my colleagues at Michigan State University to find out, what are we finding? What are the results of those kits? So a little bit more about the inventory. We have 83 counties here in Michigan. 58 of them, when we did our inventory, said, yep, we have unsubmitted kits and police property. 25 counties, all of the law enforcement agencies in those counties said, nope, we don't have any unsubmitted kits. To which we said, really? Are you sure? Are you sure? Are you sure? So we did extensive follow-up with all of those 25 counties to make sure that they hadn't stuffed some under the bed, they didn't have some in a remote locker or something. Trust me, 25 counties really, really didn't have any unsubmitted kits. We have some very, very sparsely populated rural counties. That's where the bulk of those 25 are. No kits there. But of the 58 counties that had unsubmitted kits, the total number was 3,422 kits in our inventory. They had not been submitted for forensic testing. 50% of those, were collected between 2010 and the close of our census. So between 2010 and 2015. So half of those kits came in just a 5-year period. The other half came in the decades before that. So most of them are relatively, so 50% of them, I keep saying most, 50% of them are relatively recent and 50% of them are quite a bit older than that. All right. In this study, we had 3 primary research questions. So for each one, I'm going to tell you what our question was, how we went about it, and what our results are before we move on to the next question. So the first one, as I'm guessing most of you have already sort of wondered about, is, okay, great. You counted everything in the state. What'd you find? What are the obtained forensic testing rates in that overall sample of 3,422 kits? So again, in this audience, we're all familiar with the fact that when you submit a kit for DNA testing, it actually goes through many stages. So first there's a screening, and in our project, the kits went through Y screening. So they were determining whether there was Y chromosome material in the samples there. If so, it passed from stage 0 to stage 1, where it had DNA testing. If the DNA testing yielded a DNA profile that met all of the eligibility criteria, both biological and criminalistic, for upload to CODIS, then the kit would pass from stage 1 to stage 2, where it would be uploaded into CODIS. Once it was in CODIS, we wanted to know, does it have a hit? Again, either on the offender index side or on the forensic index side, either side, CODIS hit. And then we asked the question, okay, if there's a hit, what did it hit to? And what we wanted to know was whether it hit to another sexual assault case, indicating what we call a CODIS suspected serial sexual assault hit. And the definition of that is represented here. I'm gonna give you a chance to read that while I take a quick sip of water. Goodness, very dry air here today in my house in Michigan. So our definition here is focusing only on information that we can glean from CODIS. I'm going to have another coughing fit. Just okay, I think we got it. So what we're interested in is whether our CODIS hit matched to another case already in CODIS, meaning that the qualifying offense from the reason why the person's in CODIS in the first place was a different sexual assault, or it hit to another forensic profile in CODIS from another sexual assault. This means we are not pulling the full criminal histories. So I don't know for the identified offenders if there's other sexual assaults in their criminal history records that were other sexual assaults. So this is going to be an underestimation of the number of suspected serial sexual assaults. And this is a common methodology that's used in research. I've done it with prior projects in Detroit when it may not be wieldly or possible for the research team to have access to all of the CODIS, all of the criminal history records. So we acknowledge this is a limitation of the study. It's just what we know in CODIS. It's going to underestimate it. And I'm going to give away my punchline now. And I'm going to tell you there's still a heck of a lot of suspected serial sexual assaults, even when all we use is CODIS information. Now, as kids move through these different stages, you can compute different rates. The DNA testing rate is going to be the rate of kits that move from 0 to 1. The CODIS entry rate or upload rate, you can call it either one, is where they move from testing to upload. CODIS hit rate, if you go into CODIS, do you get a hit? And then the CODIS serial sexual assault hit rate is from that hit, did it hit to another sexual assault kit in CODIS or another sexual assault case in CODIS? For each of those, you can see on your screen, there's different ways you can compute those rates. An unconditional rate is where you define the number of kits that progress to that stage over the total number of kits tested. A conditional rate is where you divide the number of kits that progress to that stage divided by the number of kits that advanced possibly to that stage. This will become clear when we go through that. One is not right, one is not wrong. They're both right. They're both ways of characterizing outcomes. It's just, for the love of all things holy, please be clear whether you're reporting an unconditional or a conditional rate so that we can compare apples to apples and oranges to oranges. So as I go through this, I'll be clear whether I'm reporting an unconditional rate or a conditional rate. All right, with all that lead up, what did we find? Of our 3,422 kits that we tested, 64% of them, that's an unconditional rate, moved from stage 0 to DNA testing. Of that, now I'm going to switch to talking about conditional rates. So of the kits that were tested, 56.5% had a DNA profile that was eligible for upload to CODIS. So about 50%. Of the ones that went into CODIS, conditional rate, how many of them produced a hit? 47%, about 50%. And then of those that were a hit, what percentage of them matched to another sexual assault case in CODIS? 26%. So we talked at the beginning, what did prior research tell us? That when you test kits, you should expect that half and half effect. That's what we found in a statewide sample. So that half and half idea came from studies only in major large urban cities. This sample is very different. Remember, our largest urban city, Detroit's not even in this. And again, we're seeing a pretty similar, about 50% will have a profile that goes into CODIS. A little under 50% will result in a hit. So the next question we had then was, okay, that's your overall state sample, but how does that vary by your geographic and your population density characteristics? Is that really what's happening in all of these different, communities throughout the state, or do you see different results depending upon whether it's a big city, medium city, or rural city? Because indeed, Michigan does have a lot of geographic diversity and population density variability. So for example, we have the Detroit Tri-County area, which is Wayne, Oakland, and Macomb. A lot of people, major urban areas, high population density. Then we have several other large cities. We have Lansing, we have Grand Rapids, we have Kalamazoo. Then we have a lot of other areas where there's like kind of one medium-sized city-ish, but after that, the rest of the county is kind of small or rural. And then we have a lot of rural counties in Michigan. We have some that are really, really sparsely populated. So we really had the opportunity here, being a statewide SACI site, to say, what do the results look like when you look at them by each of these areas? Because we wanted to we were thinking maybe that tri-county metro area is kind of pulling up the numbers, and the numbers that we're seeing really might be kind of different depending upon the geographic area. So we wanted to make some categories that would sort out the population and the geography of Michigan into some different categories. So we used standardized definitions from the Office of Management and Budget, OMB, for what constitutes a metropolitan area. So the county would be designated metropolitan if it has at least one urban area with a population over 50,000. That's actually kind of a low bar for what you would call a metropolitan area. 50,000 is pretty small. A micropolitan area is going to be having one or more urban clusters between 10,000 and 50,000. So in Michigan, we actually have many metropolitan areas, as do most states. So we had to subdivide our metropolitan areas into smaller groups based on population density. So we have category 1, which is going to be the metropolitan counties with population density over 1,000. That's the tri-county area. Category 2 is going to be our metropolitan areas with a density of 400 to 1,000. We had 6 counties with kits in that group. Category 3 is going to be the ones of less than 400 people per square mile. We had 17 counties. And then we can subdivide our rural into 2 different ones. We had category 4, our micropolitan areas with populations. So that's between 10,000 and 50,000. And the density is between 400 and 1,000 people. We had 19 counties like that, and counties with no metropolitan or micropolitan areas. We're talking really sparsely densely populated areas. We had 13 like that. So what we wanted to do now was, now that we had these categories formed based on definitions from OMB and the census, to say, how do those results that I just showed you vary by these different county groups? So let's start with our DNA testing rates, and there you have them broken out. They're very similar in categories 1 through 4. So all of our metropolitan and our micropolitan areas right around that 0.6465. We do see a lower rate, in our very, very, very rural areas, but still good number progressing from screening to DNA testing. In terms of now moving into CODIS eligibility, we said overall it was roughly 50%. And now you can start to look at it and you can say, yeah, all right. The largest one, group 1, the tri-county area, that's actually 60%. Our small rural area was actually even higher at 0.64. And then the other ones were right around 50%. So this is important, because when we said about half of our kits statewide, when we tested them, had a DNA profile that could be uploaded, we didn't know whether it was because our really populated areas were like 70% and the little ones were like 30%, and it was averaging out to be about 50%. That's actually not what's going on here. All of them, whether they're big metropolitan, little metropolitan, micropolitan, or really rural, they're all hovering right around 50%, some a little higher, some a little lower. And then when we look at whether they produced a hit, again, we said that overall sample was about 46%. And we can see that, again, all of the different groups are hovering around that 45 to 50-ish percent, except our lowest, our smallest densely populated areas, category 5, the really, really rural areas. They're not a half, they're about a third. So again, here it's important to sort of pull this out and not take an overall state average out of context. For our metropolitan areas, it's around 40 to 50%, but our really small rural areas, it's more like a third. will the uploads reproduce a hit. And then going all the way to whether they produced a suspected serial hit, that's primarily in the urban areas. You can see there that the rates of getting a suspected serial hit in our smaller areas and our rural areas, that is significantly lower. And we're going to come back to that at the end and talk more about that. So that half and a half effect that we replicated in the statewide sample, when you drill further down to look at it count in the county groupings, we generally will also replicate that, with the caveat that the hit rate for the rural areas isn't going to be about a half, it's going to be about a third. Now, the final research question that we wanted to look at is now we have all of these numbers floating around, 50%, half of a half, a third. What do we make of this? So what we wanted to do for research question 3 was some scenario planning to help other jurisdictions that are trying to decide what they want to do, to get some scenario planning projections that if you were to test kits, what might you expect? Because we're mindful that the process of inventorying unsubmitted kits is a considerable undertaking, criminal justice system personnel may wonder whether testing these kits is truly necessary and whether it will yield results at some level and quantity that would justify the time, effort, and expense of doing this. So for example, we showed you in the smaller areas, it's going to be about a third in our really, really sparsely densely populated rural areas. And the suspected serial hits are going to be much smaller in the rural areas. We know that. So it sort of begs the question then, at a minimum threshold, are the testing outcomes significantly greater than 0? Are they greater than a third? Are they greater than 50%? Because in our low density rural areas, if it's unlikely that CODIS hits would exceed these lower thresholds, stakeholders might have to really think about how do we use our laboratory resources wisely. In our really high density urban areas, if the CODIS hits exceed even those higher thresholds, you're going to want to know that for some scenario planning, because you're going to need a team ready. Because if you test these kits and you're exceeding 50%, it'd be good to know that so that you can start getting your multidisciplinary team ready to go. So for these analyses, we're testing within each category group and at each stage of testing. So we're looking at, okay, group 1, which is the Detroit metro area, unconditional, the testing, the DNA testing rates, the eligibility rates, the hit rates, the serial sexual assaults. I'm going to go through this a little faster because the results are really give us a clear picture, but I'm happy when we get to Q&A to unpack this further. So when we look at, is it better? Is it higher than 0? Is it higher than 0.33? Is it higher than 50%? When we look at these sort of entry level, those first stages of the process, and we say, is it worth it to test these kits when we think about it from the point of view of populating CODIS and getting a profile into CODIS? Absolutely. In all of these communities, all of these different groupings by geography and population density, our rates are significantly better than 0. They're significantly better than 0.33. And our larger cities are even above 0.5. So strictly from the point of view of testing populating CODIS, is this worth it? Yep, it's worth it. Is it worth it in terms of informing sexual assault investigations for CODIS hits? The answer here is still yes. The rates are significantly higher than 0. And in almost all but our really small rural areas, it's above 0.3. And in some areas, it is even above, it may not get above 0.5, but it can get close to 0.5. So can testing help sexual assault investigations? Yes. Again, big, medium, and small communities. Can it help you find suspected serial offenders? Yes, if you live in a big city. Can it help you find them in smaller areas? Yes, there's just not as many to find, is what our results suggest. That yes, testing kits will help you find suspected serial offenders. That seems to be more common in the urban areas, but in the rural areas, it's less common, but you're still going to find them. All right, so let me take a few minutes to wrap this up, and then we definitely have some good time here for questions and discussion. So first off, the SACI statewide sites are a really good opportunity for us to expand research, to move away from the sort of large urban areas, Detroit, Houston, Cleveland, LA, not criticizing those studies, great work in all of those areas. It's just, it tells us what we know about urban areas. The statewide sites are really an opportunity for us to open that up and see how this varies and what the role is by geography and population density in terms of what we get out of testing kits. So in this study, even with the exclusion of two large cities, Detroit and Flint both have pretty high crime rates, we still found very strong yield rates for CODIS eligible profiles and CODIS hits. So at the top of this, I said, remember, I'm going to tell you, we're going to come back at the end. Does it matter if we excluded those? Well, if we had included Detroit and Flint, the numbers certainly would have been higher, but it's not being driven by the results in Detroit or Flint. Overall in our state, we had a lot of kits. Overall in our state, when you test them, even in the smaller jurisdictions, you still roughly are going to find the half and the half effect. So it's not due to our larger areas pulling up and averaging. All of them are generally finding something around 50%, maybe a little higher, maybe a little lower, but all sort of around the 50% mark for CODIS eligible profiles. And again, around 50% for the CODIS hits, with the proviso that for our rural areas, it's not going to be a half, it's going to be a little closer to a third. That's still useful, okay? It still emphasizes the importance of SAK testing in smaller and rural. That's still a lot. In a rural area, to find that even a third of those kits are still going to yield a hit, that's a lot for our rural communities to take on. The CODIS serial sexual assault hits are primarily in the urban area, but this is really important. Even in our communities that had between 10,000 and 50,000 people, still 1 in 5 of those CODIS hits hit to another sexual assault. It's like, whoa, mind blown. Think about that for a second. So I've been saying, yeah, the rates are lower in rural areas, and they are. But even so, it means in communities as small as 10,000 to 50,000 people, 1 in 5 of our CODIS hits was hitting to another sexual assault case. And remember also, that's an underestimate, because I don't even have all of the criminal history records. I just know that these offenders had another sexual assault in CODIS. They could have other sexual assaults in their criminal histories, and prior research would tell us they probably do. So that's an underestimate, even in our rural areas. And speaking of limitations, though, we of course acknowledge that we don't know how the law enforcement agencies in all of these counties utilize the CODIS hit and how it might have affected the investigations. And that remains an open question. And I'm thrilled that I have the opportunity now to work with our colleagues in Kalamazoo County in Michigan, where we finally are going to get to do a deep dive into that research to say, how do you utilize that? But in this statewide sample, I don't have that information. So Amanda, when you're looking at the chat and you're asking about that, there's the answer to everybody's question. I don't know. We don't have that in this study. I don't mean to be glib. I'm just saying it is a known limitation of the study. We will follow up on it in some future research. And we're looking forward to see how our results compare to other statewide jurisdictions, and to really start getting into this question of how do the results vary in urban areas, middle areas, medium areas, small areas, and our rural areas. So with that, I'm going to stop the formal presentation, and we've got lots of time here for questions, and I'll leave my contact information up here. I'm happy to send the article to anybody who would like one, so feel free to email me and I can send it along to you and your teams. So with that, I'm going to see what kinds of questions that people have in the chat or otherwise.
Thank you, Dr. Campbell. We did get a few questions throughout your presentation. The first is from Chris Henning. Any thoughts on whether the half and half effect is true for the kits that were submitted as a normal part of the cases, so not the SACI kits? Or is it something to kits that weren't submitted?
Wow, what a great question. And like, as they say, DM me so we can figure this out in a future study. I don't know. I don't have those kind of data, but I think that is a really, really good question. So here's a couple of things that I'm thinking about. We know that the older kits in our state, and I suspect the older kits in a lot of states, were not collected by specialized forensic nurse examiners, sexual assault nurse examiners, or safe sexual assault forensic examiners. We know that people who have that specialized training, that have the SANE designation, they're better at it. They just are. The empirical research is there. Bring it. I'm ready to argue with anybody. They're better at the forensic evidence collection than, bless their heart, an ER resident who just, is following along and doing a kit for the first time. So the recovery of the evidence is better when you have a SANE or a SAFE doing that. We know that we now have more SANEs throughout the US in the last 5 years than we had in the prior 5 years than in the prior 5 years. So I think the yield for having a profile being able to be extracted is better in our recent kits, because I think that has a lot to do with who's been doing the collection. But that's a hypothesis. And I think that that's something that we can look at, and we can, the SACI site really gives us an opportunity, SACI National Project gives us an opportunity to look at that and to really drill down and to say, who collected the kit, and does that matter in terms of the hit rates? The other thing that I'm thinking about with all of this is this is all an incredible moving target. CODIS is populating right now as we speak. People are loading profiles in. Each Monday it refreshes. So the more we populate CODIS, the more reference samples we have, the more opportunities we have for hits, because we have more opportunities for a match. So it's this constant kind of rolling basis that on the one hand is good, and on the other hand, for all of us in the research community, we're like, could you freeze CODIS for just a little bit so we can get like a count and it's not changing on us? And obviously we couldn't do that. We wouldn't want to do that for policy reasons. But CODIS keeps populating, so the expected hit rate, I think, is a moving target too, because the more it populates, the more hits we get. So my team and I were working on some projections and some modeling around that. We got kind of distracted with COVID, as everybody else did. But I think that's another really interesting area where, how do you know what to expect when CODIS itself is getting bigger and bigger every day?
Thank you, Becky. We have another question. Where did the 25 counties with no unsubmitted kits fall within the county population density categories?
5, category 5. There are really small, really sparsely populated counties. So it is, we have, those are our category 5s. And even then, again, our SACI coordinator was like, hi, double checking, triple checking, you sure you don't have any? We feel pretty confident really that those 25 truly didn't have any. And when we talked with our colleagues from the Michigan Department of Health and Human Services, they're like, that makes sense. Because if somebody was sexually assaulted in those counties, again, to be clear, we're not saying there's not sexual assault in those counties. If somebody was sexually assaulted in those counties, there's really nowhere to go to get a kit. So they would have moved to another kit, and the kit might have been in one of our other nearby rural counties where it was found. So those 25 are category 5s.
Thank you. Lisa Gray asked, for the serial offenders in the less populated areas, do you have data about whether they hit to other assaults within those less populated areas or assaults elsewhere?
Oh, Lisa, what a good question. I don't know, but you can rest assured that the RA, the research assistant on my project, is going to be getting an email after this. I didn't think about that. That's a great question. That's going to take some digging. I don't know. I wish I did know. Thank you for that suggestion for us to follow up on. It really highlights that kind of the challenge for all of us doing research in SACI is the breadth and the depth issue. So I have in this study decent breadth, 83 counties, 58 have them. I know if they have something in CODIS. I don't have the greatest depth in this particular study. So I don't have their criminal history records. I don't know whether that happened in another county or whether they've crossed county lines. So again, hopefully this presentation is useful to some of you other folks doing research to say, wow, here's some things we want to do differently in our site to be able to get more depth. I just don't have it in this study. I'm going to find it though.
Thank you. We have a question from Richard Johnson. How many SANE programs are in the state of Michigan?
Great question. Again, goes back to that answer of it's a moving target. Right now, today, January 2021, we have 25. How many did we have in 2019? 18, you know, back. So we've had, I would say the smallest number we've had, well, was 0, obviously, but I would say the bulk of the time that these kits were being collected, we had probably between 5 and 8 in our state. But again, when they came on board varied. Thank you. Also, that gives me an idea of something we could try. I could look at our data to see based on, I do know when the SANEs came on board in different counties, we could try to model that. That's an interesting idea. And again, for those of you still doing your data collection, that would be an important thing to keep track of as, do you know whether it was collected by a SANE provider? When did the SANE in your county come online? Because that would be a marker that you could use in some different modeling.
Thanks, Becky. It sounds like you and your RA are going to have a lot of additional questions to follow today.
And again, I don't know how far we'll be able to get, because again, this was more of a breadth study than a depth study, but I hope every time I say, I don't know, that I'm actually helping everybody in their research that they're doing right now to say, you know what, I don't want my answer to be, I don't know. I want to be able to have an answer to that. We focused on breadth, not depth. If you're focusing on depth, hopefully this is giving you ideas of some things that you're going to want to drill down to, because there's just so much opportunity here from us to learn from each other across these different sites.
Great. We have Leslie Hagan, who said, Michigan has 12 federally recognized Indian tribes. The FBI has jurisdiction to investigate sexual assaults occurring on the reservations. Forensic medical exams can be done in local hospitals, with kit being sent to MSP for analysis or to the FBI crime lab in Quantico. I'm assuming that if the kit goes to MSP, it likely ends up in the county count, but I'm curious, were tribal cases separated out at all?
Thank you, Leslie. Hi, Leslie. Thanks for asking the very, very complicated, technical, legally nuanced question that you have, given your extensive experience on this. I did look at this. I don't know that I've got quite as good an answer as you would like, but we do have, you're quite right, federally recognized tribes in Michigan. As best we can tell from working with our partners at the state, talking with our colleagues at the Michigan State Police Forensic Labs, those kits that were collected in federally recognized tribes went to the county. Yes, you're right. They could have gone to the FBI. As best we can tell, the vast majority, if not all of them, actually went into the county seats. They were captured in our state inventory. They were inventoried and taken into custody by the Michigan State Police and were tested. And then the results went back to the county prosecutor's office and the local law enforcement agency. As I noted, a limitation of the study is I don't know what happened after that. We're hoping over time in this project to be able to answer, you know, which law enforcement agency picked these up? Was it useful to the investigation? Did it go back to the FBI for our Indian cases? But as far as I know and have been able to determine, they went into the county coffers, if you will, the county count, not over to the FBI.
Thank you for that response. Dr. Julie Valentine asked, is data available on the number of Estes entries per state by year? I think Utah's low hit rate is largely due to low Estes numbers, especially in the past, but would like to know this information.
Hey, Julie, great question. I don't know. I think that, how do I put this diplomatically? Oh, let's not do it diplomatically. There are state to state variations. We know this. And I think a lot of it has to do with how state CODIS administrators interpret CODIS eligibility requirements. You'll notice all throughout the presentation, I kept saying, if it met eligibility for CODIS, as defined by FBI. So the FBI does have standardized definitions. They are locally interpreted, local meaning the state there. So each state CODIS administrator does interpret those requirements. And I think there are state by state variations on that. And I don't know of any compendium of that other than what we do here in the SACI project. So I can tell you, I can show you my Michigan rates. You got the Utah rates. We have other statewide sites. I think that's what we can do here as part of the research community doing this, is maybe pooling data, comparing data across states to see if we are seeing in the data what we suspect is true from our practice knowledge, which is different state administrators are interpreting those eligibility criteria differently. So if a profile can't go into CODIS, you're not going to get a hit from it. So if we have gatekeeping of profiles going into CODIS, we will see state by state variation on the entry rate or upload rate, and therefore ultimately the hit rate, because you can't get a hit unless it goes into CODIS. So it's a really important question and issue that you're raising, Dr. Valentine. And I think that the SACI project data from other people who have state data are our best bet at trying to get at some of these questions.
Thank you, Dr. Campbell. Julie, I did see you come on video. Did you have anything else that you wanted to add for that?
No, that was great. I'm just, I think that when we're comparing hit rates, we also have to factor in, well, what is their Estes numbers look like? And, we could look at that per capita as well, because my guess is that Utah's overall is low, but that's my hunch. And that's my hunch with, the crime lab director. I would just like more information to see, is that actually the factor or one of the factors that's influencing this, along with the gatekeeping, which is certainly an issue state by state.
Yeah, I agree with you. I think it's there. And I think that's also why I keep talking about the importance of conditional and unconditional rates. It's like, remember when our teachers taught us division, they were always like, what's your denominator? So we have to track the denominator. We have to keep an eye on what's in the denominator, and know that there can be some state to state variations in what they let into the numerator, and therefore it's going to affect what comes into the denominators over time.
Thanks.
Thank you both for that discussion. We do have a few additional questions. Michelle, what is the communication amongst agencies/states with identified serial rapists? Just a phone call, or is there a process?
That's a great question. I think that's, again, one of the things that this National SACI project is realizing is that I think we don't have a standardized protocol for that. We've heard at the National SACI TTA meetings of cases where some really amazing dedicated law enforcement professionals in different jurisdictions was like, I'm calling the next place and I'm going to keep advocating, I'm going to keep pushing. And we've heard, many stories of nurses and advocates sort of doing that on a case by case basis. But I think there is a lot of discretion there. And again, when I say that one of the limitations of the study is I don't know what happened to these hits, that's a major limitation. I don't know what happened. I don't know what happened specifically with those suspected serial hits and exactly how they're all being followed up on. So I think that's one of the things we try to do in the National SACI project is create the linkages, create the norms for that. My colleague, Sergeant Jim Markey, does a great job when he does, site-specific training or regional trainings to say, make this your norm, make this your practice, pick up the phone, write a protocol for it, better yet, and make this part of your standard practice that when you have a hit to a case in another jurisdiction, do the right thing, do the follow-up, and let's start creating protocols for that.
Thank you, Becky. Paige, I just saw that you came on video. Did you have a question you'd like to ask?
Yeah, and I know we are constantly asking Dr. Campbell to look into her crystal ball and talk about the future, but one of those types of questions for you and even for Dr. Valentine is, what do you think about the impact of lawfully owed DNA testing on this conversation, including if we look at, Dr. Valentine's question about it being by year, are we at this point like, okay, this number of folks have actually taken SACI up on dealing with lawfully owed DNA, taken purpose area 3, let's see what that does to this data.
I would love to do that. So if we have, I know that Dr. Hannah Feeney from RTI is on here. Hannah, write the grant, make this data modeling happening, because it's a really important question. Because remember, when I said that CODIS is constantly evolving and changing, it is. It's like every day people dump more in terms of lawfully owed DNA, and that's a big one. If we're growing the reference samples in CODIS, particularly the offender index of lawfully owned DNA, if we keep growing that bigger, the chances of hits increases because we keep populating CODIS. So it really does call for sort of a more nuanced sort of year by year. Once this policy was implemented, once this practice of lawfully owed DNA did we see a really marked jump? Regression discontinuity design for all my research geeks here. It's a great, we've got, it's built in here. We just need somebody to sit down and find the data and crunch the data to see if that's the case. I don't see how it couldn't increase hit rates. You don't get a hit if it doesn't go in. And if we put a whole bunch of more profiles in, chances are we're going to get more hits. And I think we're going to get more serial hits too. Again, what we see from research Dr. Rachel Lovell's done in Cleveland, what Dr. Feeney and I have done working with Detroit data is that a lot of offenders do sexually assault more than one person. They're not particular. There's a lot of crossover offending across ages, potentially across genders, across different points in their lives. So they do a lot of offending. The more we populate CODIS, the more we're likely to find that.
Thank you. We have one more question from Chris Henning. Did you capture why kits weren't submitted? And if so, have you thought about adding those categories into your models?
That's a great question. We do have that in many of our counties, but not all of our counties. So that was something I had hoped to model, but I didn't like the completeness data that we had. And as you can appreciate, trying to estimate that missing data puts you in a place I was not feeling strong enough analytically to do. Yeah, so I tried. I didn't have complete enough data to feel like the model was really, would have the analytic quality that I wanted, so we didn't model it. Why didn't they, submit the kits? Didn't believe the victim. The victim didn't, act in a way that they felt was consistent with the way trauma should be. The named offender was somebody they knew. They thought it was a he said, she said. They didn't have resources to test it. Those were the common reasons that we heard, which again, I know many people, that's been replicated in many other studies. But if any one of those reasons was more salient or had an effect on our model, I wish I could have done it, but we just had incomplete data, particularly in our rural counties, that I couldn't model it on a kit by kit basis. So I hope somebody else can. I just couldn't in this study.
Thank you for that response, Dr. Campbell. We are nearing the end of our time for today. So before we close things out, Becky, do you have any final words that you want to say?
Nope, I appreciate everybody being here. I thank everybody for the good questions, the hard questions. I've answered as completely and honestly of all the foibles that we had in this study. And I'm really grateful to be part of a learning community with all of you, and that all of you have data. And that I hope that the good, the bad, and the things that we did in this study can help inspire you to collect data in your counties and your communities in different ways, that together we can start getting a better picture, both at the site level and at the national level.
Thank you so much, Dr. Campbell, for your fantastic presentation today. We are getting all sorts of kudos for you in the chat.
Thank you. I can't follow the chat. I can't look at it, but thank you everybody for doing that. And I did scroll through and I see colleagues from the Michigan State Police, like shout out to Kristen Schelling, and an amazing amazing group of colleagues at the Michigan State Police who are incredibly patient with every little nagging question that I have. So thank you all for your collaboration, and thanks everybody for coming today.
Thanks, everyone. We hope you enjoy the rest of your day.
Take care.